Three simple words. Together, we're better. They are words with true meaning that defined our past and will chart our future. I'm James Brown, and I've been a member of the KCHC family for several years. For more than 25 years, KCHC staff, volunteers, and members of our community have worked together, building to make our community stronger.
Kingston Community Health Centres, fondly known as KCHC, has been caring, responding, and building community for the past 25 years, offering comprehensive primary health care, health promotion programs, and community development services. Last year, KCHC introduced the KCHC Link to Health, a symbol meant to convey the idea that we are all connected and the changes we want in our communities cannot be achieved by any one person or organization alone. KCHC chose the Big Blue Link as the symbol of its 25th anniversary campaign, as it brings citizens together to live and work together to make our communities healthier. KCHC believes that together we're better, and we are stronger because of the links between community and health. Kingston Community Health Centres was originally established as the North Kingston Community Health Centre and opened its doors in 1988. Throughout the years, KCHC has made a special effort to serve people at a high risk or poor health, or who have trouble finding health care because of language or cultural barriers, poverty, or isolation. Grounded in a community development approach, KCHC knows that community members are in the best position to know what they need in order to achieve and maintain their health. That means that for 25 years, AMBI has accessed a wide range of health services provided by a multidisciplinary health team.
We have everything here. I can see my doctor, the nurses, getting my feet done, which is a blessing because I can't bend down anymore. And there's a dietitian, there's a social worker, what helps you out if you're in trouble.
KCHC's primary health care expanded in 2004 and in 2008 to include our Street Health Centre and the Napanee Area Community Health Centre. It had long been a dream of the Napanee community to have a health centre that was accessible and meant residents didn't have to travel long distances. Just ask Stella in Napanee, who doesn't have to travel nor wait in a hospital emergency room for ongoing care for herself and her husband.
My husband is now a diabetic, so it's so much more convenient to come here than to have to go to the hospital in Napanee for the services that you give here. Like, there's no waiting time, he's taken right in, so it's fantastic.
Aboriginal health is a core to the services offered in Napanee. Listen as Colleen describes the partnerships with the health centre.
We help to decide how things are being run. We help to design the brand new building that is going up with the Napanee Health Centre.
Using a harm reduction approach, the Street Health Centre's primary mandate is to reduce the burden of illness resulting from drug dependency. Listen as Jasmine and Tom tell you how they can find kind, judgment-free support, and they are making positive long-term changes in their lives.
I'd offer people the advice that's very helpful, very kind, comforting. You know, like they care. Each person's different that goes in there. Like, there's of course stigma that's attached to it maybe, but you know, I've never felt uncomfortable there. I've never felt unwanted there. I've always felt welcome.
I left here with the feeling, boy, there is something for me. Like, maybe there is a light at the end of the tunnel. I'm clean and I owe my life to Street Health.
The Ontario Harm Reduction Distribution Program joined the KCHC family in 2006 and provides harm reduction supplies and educational materials to needle syringe programs across Ontario. In 2013, Thrive, a regional program for parents of children 6 and under, joined KCHC to help parents struggling with substance abuse. Still in its infancy, this program is already showing that by supporting families, change can happen. Youth Space came on board in 2009, providing young people under the age of 26 with a place to call their own. The Space, as it's commonly known, provides hepatitis C information, harm reduction education, a food and clothing cupboard, as well as sexual health information. In 2010, KCHC expanded its healthcare services to include dental health through a unique partnership with the KFLNA Public Health. Accessible dental care for children and families in financial need is available. KCHC recently took on the stewardship of 2 regional programs, the Living Well Self-Management Program of Southeastern Ontario and Telemedicine, programs aimed at improving access to primary care and helping clients take control of their health care through education. Since 1988, KCHC has worked with local residents and community partners to pursue initiatives that improve community health and well-being. KCHC has been proud to support the development of community gardens, Operation Warm Feet, a splash pad, multicultural festival, and the Good Food Box, just to name a few. KCHC helps people become stronger, more confident, and valued contributors in their neighborhoods and communities. Listen as Jim and Wanda describe their involvement with the Good Food Box and Operation Warm Feet.
So we started with Operation Warm Feet. So now the kids have an opportunity to get a new pair of boots every year.
You save money more by buying the Good Food Box than you do at the grocery store. We did a survey, and it costs more for the amount of stuff you get from the Good Food Box. It costs you almost double.
In 2006, Immigrant Services Kingston and area joined the KCHC family. ISCA is the commonly used name for settlement services including citizenship preparation, getting a health card and driver's license, learning English, and education for families. Listen as Yves, a young man from Congo, wanted to meet people and develop connections in the Kingston community. But according to Anna Sunasa, ISCA is more than a collection of services.
ISCA is a friend to the new immigrants, a very good friend to the new immigrants who come to Kingston, because ISCA tells them a lot about how to move about in this society, have been very, very helpful in making us comfortably settling in Kingston.
I started coming to ISCA because I didn't know anyone in Kingston and I wanted connections and I wanted to get to meet new people, so ISCA was a very good place.
Children learn more in the first few years of life than they will in the rest of their lives. That's why in 1992, KCHC agreed to sponsor the Better Beginnings for Kingston Children. Known as BBKC, the program supports families from pregnancy until 4 years of age. Prenatal education, home visiting, school readiness, and playgroups are just a few of the services provided. Listen to Kelly and Sue, 2 mothers who turn to Better Beginnings for help. Through their stories, we see how parents learn from each other, while their kids learn to socialize and play.
So it was, they wanted to find out where I was from and, what brought me here and, what's your baby's name? And I left that day and I told my husband when I went home, I said, I'm going back next week. I have to go back next week. It's amazing. So I went back the next week and a week after that. And it was just like I had found a new family.
I started out with playgroups because the youngest of my 4 children was the only one at home at the time. The others were all in school all day. And we had nobody in our neighborhood with kids the same age as him. So I was looking for something for me, somewhere to connect with children, parents of children of the same age group, and something for him. And I connected to a playgroup and they were just fabulous.
Education is a key social determinant of health. So when half of all high school students in North Kingston were dropping out, KCHC stepped in to help. In 2010, our Pathways to Education program opened its doors. Through the 4 pillars of support, tutoring, mentoring, financial support, and advocacy, youth in North Kingston are being supported to stay in school, graduate, and explore post-secondary options. Listen as Cody describes the support he received.
The way Pathways to Education benefits me, most times it benefits through the incentives, being $30 for groceries, which was a big help. And then there's the homework tutors, coming in, say you got a big science project, and you can actually sit down and say, okay, I don't know how this works, can you show me how?
KCHC has grown from a small staff of 8 when it opened its doors in 1988 to a staff of 150 people today. Throughout KCHC's long history, one thing has remained the same: our roots in the communities we serve.
25 years experience working with staff, volunteers, and community groups, delivering both care and services have proven, together we're better.